It's 12:05. We do have a quorum now, so I'm glad for that. Our first order of business is for public comment. Before we start public comment, to include in public comments, we wanted to open up to the community to have a voice in our hospital appointment, our board appointments today. We have 3 candidates. Only 2 of them are here today. We have Virginia Turner and Tyler Steinbaugh, and our other candidate was Robert Larson. So I'll go ahead. Who would like to go first? Do we have some public comment?
Could they maybe stand up and
Introduce yourself? Yeah,
themselves
that would be great.
And know what.
I'm Shirley Mancini. Who are you replacing on the hospital district board?
Dr. Patterson, since he's moved away. He was dropped in the last month, and then we opened the position up. And it was a temporary position until the election in May, so it's just for 4 months.
I'm Leon Crichton.
Go ahead, Leon.
I'm sure you all know me by now. My concerns about the layoffs, I know you can't discuss them as individuals, but according to this newspaper article, which I'm sure you must have approved, the layoffs were conducted on seniority where employees had been there the longest kept their jobs.
I don't remember reading that.
Yeah.
That's correct.
One of your layoffs was an employee of 8 years. Had worked in many departments in the hospital and the clinic. She happened to be in a part-time job at the time these cuts were made. But I find it very strange that you would take someone who has experience in the kitchen, in housekeeping, in receptionist at the clinic, and in physical therapy, and let her go. Surely you have somebody else with a lot less training and a lot less seniority that could have gone. You got rid of your only licensed boiler engineer, whom you paid to go to school to get the license in the beginning. I don't believe he was offered a reduction in pay to keep his job. With his experience, he built your mammogram suite, he built your Steve's Frisbee golf course, among other things. And the way he was let go, called back to work on Christmas Eve and told not only he, but also his wife were being laid off, is one of the coldest things I have ever heard of in my life. I'm sure you knew before Christmas Eve that he was gonna go, and to wait that late is just inexcusable.
We can jump to that. You want me to just address it? So.
Well, Leona, we do have that. We did put it on the agenda because you had requested that we discuss those on the agenda. So can we hold off until that part till we can talk about that?
Yep.
Okay. Thank you.
I'm Tyler Steinbaugh. I'm here as trying to point the door closed to get more interested in what's going on at the hospital and all that, even though I lived here for my whole life, so I'm pretty involved as it is. But I guess, I don't know, what do you want us to talk about now, later? I don't know.
We're going to do that in a little bit.
That's what I thought.
Yeah.
So I just, for that.
Mike, did you have some comments? Go
Yeah,
ahead.
my name's Mike Curtin. Been a resident for a few years here. Taxpayer. And the layoffs here, I don't know, there was 8 people, I think, y'all laid off. And an article there in the paper was because your revenue has not met what you had projected. And you're trying to cut corners, not cut corners, you're trying to trim it down so that you can stay working, and I'm assuming so you don't have to hit the taxpayer with more debt. I thought Dr. Smith was a member of the hospital board now.
He is.
Okay.
He should be here, I would think.
Yes, he should be.
Yeah,
here.
He's invited.
yeah.
Yeah. Anyway, he was elected, he had 400 and some votes, approximately probably 10% of the county residents. Probably 80% of the voting population, the people that did vote, and there's probably a lot more. You're talking about increasing revenue, and I brought this to this board years ago when you first got rid of Brim, and I applauded you for doing that. And then I brought, you guys have to take the next step to bring the county together. Now, the county, over a decade ago, when this whole thing went down, you had 3 people, the Brim manager, a banker, and a doctor, had backdoor meetings and concocted something that he was totally exonerated in Helena over. And those patients he had over, or approximately half of the county were his patients. Some of them did stay. A lot of them went to Plains with him, and some of them decided to go to Missoula and get other doctors. Those people are not using your facilities. I'm paying taxes to float the boat here, whereas these people, if you can do something to bring this community back together. I mean, it's split, and it's been split for a decade. I won't come and use this facility. Not because for 10 years, you had 2 doctors here, and everything went along just the way it went along. Since then, you've got a revolving door on doctors coming and going. And that is unacceptable to the residents of this county. We want good health care, but you want reliable health care. And if doctors keep coming and going, you don't know who the heck you're gonna see next, or if you're even gonna be able to see somebody. So, and then with all the other things here that's been happening, the corruption over that $10 million grant and everything else, you know, we're out here. I don't come to all your meetings, and in fact, the last one I came to was probably 6 or 8 years ago when you guys got rid of Brim. That's the last time. I'm entrusting you, you guys were voted into place to take care of the county, the community, the people, the residents. That's what we want. We need some stability here. You can't just keep taking my tax dollars and not giving me the stability. I want a hospital. Now, I'm Irish, so I really don't use a doctor very often. But my cousin Melody, she's at the doctor all the time. I had to take her to Plains yesterday for a CAT scan. She gets an MRI every couple of years, usually done in Missoula. These things, I think you have these machines here, she could do it here. It could be revenue to this county hospital. But until there's stability here, we're not gonna come in the door. And 400 and some people, like I say, at least 10% of the county voted Dr. Smith in. They want the same thing. They would like him back. Now, I'm not gonna go into all the particulars why it all happened. You know, you guys have all seen the records and know why you guys don't wanna he's been a resident here for almost 20 years. He's been a good doctor for that. He's leaving Plains now, and he's looking for a place. That would definitely bring probably 20 or 30% of the county back to this hospital. But if you don't do nothing to mend the fences, those 20, 30% are gonna continue going elsewhere. So, and that's all I got to say.
Thank you, Mike. I think we share some of the same concerns, so.
Thank you.
Is there any other comment? Okay, let's move on to our approval of minutes. Did everyone have a chance to review those? I had just a couple of changes.
Is there another package over there? Actually,
Do you have it?
I have, I printed
Um,
one out already.
On just the very first one, the call to order establishment of quorums, the establishment of the quorum, there wasn't a motion for that. That was actually a closing motion for the finance committee. The ones that are referenced here by John and Lloyd. I had one other one. That was under new business, under the letter C, it says that I had met with the county attorney. I didn't meet with the county attorney, Lori did, so I just don't want that confused. Does anybody else have any other changes? John, Jim, Gary?
Okay.
Okay.
I'll make a motion to
Thank
approve the
you.
minutes with the changes.
Thank you, John. Thank you, Jim. All in favor of approving last month's minutes?
Aye.
Any opposed? Okay. Minutes have been approved. Let's go on to our unfinished business, the CEO Recruitment Committee. We established last month, we had a committee to go put together the job description. I think we're at a point now, it probably won't be for a couple of months before we actively start recruiting. We have to get the organization in a position to where it can be attractive to good candidates. And in meeting that committee and meeting with Larry, we decided probably not until March. Is that about where we're looking? But I think we're at the point where we need to establish a recruitment committee and start getting all of the pieces in place before we actually pull the trigger on this one. So,
A recruitment process, we have the
Mhm.
committee.
well, it wasn't established as a recruitment committee, it was the job description committee.
Okay.
It could be the same one.
Yeah, I thought
But-
we were doing the whole thing.
But that's not what
okay,
it was.
fine.
It
Okay.
wasn't called that.
Okay.
So,
I mean, we have another meeting set up for the beginning of February. We have a draft job description at this point.
I think until you get your financial situation a little more stable, it's gonna be difficult, as Amy said, to, attract qualified candidates.
Yep.
To the facility.
so I'd entertain a motion that we establish this official committee so that we can start getting the pieces in place.
All right, well, I'll make that motion that the job description committee also be the recruitment committee. Obviously open, if there's anybody else we think we need to put on it, it's fine.
So right now, that consists of John Woodland as the chair, I'm on it, Larry, and Tanya. I think it would be good if we could have another person on that.
Interested in-
Lori, would you
Okay.
like to be on that? Okay.
Okay. We have, Lori, a meeting scheduled for...
6th or 7th.
February 7th.
Is it the
February
7th?
7th.
Oh. I'll be there.
Okay. It's, it starts at 1 on the 7th, but...
Yeah, we heard that day.
Can we reschedule that?
I can.
I can reschedule that.
Okay.
It's the 6th.
But,
What works
what
for
day
you?
was that?
It was a
That's
Friday.
a
Friday.
Friday.
It was 2 weeks from today.
And are you going all week or just that day, or?
Wednesday through Friday.
Wednesday through Friday?
Mhm.
Let's see.
I'm available earlier in the week too, if we wanted to do it earlier.
Following week.
That would be okay.
Yeah.
Then the
For me.
following week, I'll be in Billings at the Mako convention, so.
So why don't we do it earlier in, that week, that first week of February?
That's community you.
Do you have my calendar? We're running around the county with Cindy, right?
Yeah, that's on Tuesday, I think.
Tuesday and Thursday, right?
Okay.
Maybe Wednesday.
You could do.
You said you're gone Wednesday.
You could do Tuesday morning.
Oh, yeah, that's right. It's in Superior on Tuesday, right?
Yeah, Tuesdays is Superior at 4:45, so.
Sure.
We had this set for 1 o'clock, which I know 1 was better for Amy. So do we want to do it 1 o'clock on Tuesday the 4th?
Does that
Fine
work?
with me.
That works for me.
Works for me.
Okay.
Okay.
We're here.
In the blue building. I
In
think.
the blue building,
Across.
the old CEO office. Okay, so we have, is there anything, does anybody else have anything on that topic? If not, we'll move on. We have an open position that we need to fill, and I hope everyone brought their questions for Tyler and Virginia. I got a message from Robert, he's ill, so he wasn't able to be here today, so
Is he still interested?
he is,
Okay.
he is still interested.
Amy, I didn't get a second for the motion.
Oh, thank you, that's why we need you.
I'll second
Thank you.
Okay, all in favor of the recruitment committee
Aye.
as we
Aye.
discussed? Okay, any opposed? Okay,
Thank you.
passed. So I'd like to take this opportunity just to ask you guys some questions. Maybe we can start out, we can start with you, Tyler. If you could just tell us just about yourself.
So I'm Tyler Steinbein. Lived here for my whole life except for the few college times I've been out, but I'm an advanced EMT in Montana. I've been worked on the ambulance here for about 4 years or a little more or something like that, and just very interested in getting more involved with just the hospital in general, not even because of stuff going on, just in general. I'm a current sophomore in college for psychology. I'm basically I'm on a lot of different boards around the area of Western Montana. I serve on the Western Service Area Authority, which oversees mental health services for Western Montana. It's just, other than that, I've just been very active in the community, well, since I was in high school, I guess, and very involved in everything that's gone on, and I've usually very productive and like to get things done and help move things forward when they need to be done, so.
Thanks, Tyler. Virginia, can you tell us about yourself?
Yes, I'm new to Montana, about 2 years, and I've had a lot of jobs, experience, and I've been retired quite a few years, and I want to get sort of involved to keep myself busy. That's a very selfish motive, isn't it? Sort of like get involved and get to know the community more, because I'm pretty much a hermit. I stay home and, don't really go out, and but I'm getting to that age where pretty soon I'll be probably here. Either in assisted living or nursing home or something, so I would like to get to know more about it, and what I can bring is that I'm very lackadaisical until I have a project. And then I stick to it, and I follow through. I'm dedicated when I decide that's what I'm going to do. And so I thought, well, this is just a short-term fill-in, would give me a chance to not only get to know all the members of the board and how it functions and what your goals are and how you're accomplishing it and what your issues are. And I feel that in this way, look, I get to meet some people that come to this meeting. This is the first time I've been here. And so that's mainly what it is. If you have any questions, feel free to ask me.
You, are you an RN?
Yes.
I saw in your application that you have a nursing background.
It's a nice skill to have on the board.
The one other question that I have for you is, I want to make sure before we make any kind of decision that we don't have any serious conflicts of interest. And the biggest one is that, according to our bylaws, that we can't have a hospital employee. You're not, either one of you, a hospital employees, correct? Or do you have an immediate family member that is an
I
employee?
have, the only family member I have in Montana is in Bozeman,
Okay.
my granddaughter.
Okay, is there any conflict there?
What's your bylaws defines immediate?
Like your parent or a spouse or a child or a sibling? I think it would be like first degree. You don't have any? Okay. And do you see, according to the other things that you're involved in, not that it doesn't preclude you, you would just have to recuse yourself from anything if there was any conflict that way. Is there anything that could potentially you would need to recuse yourself as far as a conflict of interest?
Not that I can see.
Okay.
Yeah, I don't foresee anything. I would if I had to. I don't foresee what that would be.
Now, you mentioned that as a temporary, but come election time, would you be willing to run for the full term?
I'll say that if it interests me and I feel that I can assist in any way, yes, I would.
But whether I would run, I plan to, like I said, I'm gonna see how this, see how it works. But yeah, I'm interested.
Tyler, did you also apply at the health center, the clinic? Or there's openings at the clinic, regional health center as well. Did you also apply there or no? No, okay.
Go.
Go ahead.
I was gonna
I
s-
just had two questions. Virginia, do you think you can adequately represent St. Regis community?
I think so. The first year that I was here, I sort of skipped around the 3 churches, so I got to know quite a few people.
Okay.
And I know some people at the school and some people in the community. And yes, I think I can.
Okay. Then I wanted to ask Tyler, that you indicated you're a sophomore. Are you in the college track now?
Yeah.
Would that interfere with your duties on the board?
I don't see how it would, no. I'm doing online for this semester, and then I'll travel back and forth to U of M, doing some online and in classroom, because some of my classes have to be done in the classroom. Other than that,
Okay.
I'll tell you why I asked Tyler that question, and I mean, I think it goes back to the conflict of interest in this sense. I think Tyler and Rob Larson would both be good candidates. Rob's a sheriff's deputy in the county, and he's a volunteer on my department and has some experience in that aspect too. Rob would probably have a pretty serious conflict of interest with the health center because his wife is the nurse there, and I was thinking, well, maybe Tyler there, Rob here, or something like that. I don't mean to slight Virginia at all, but I know one of the things that in one of the articles that we looked at in the Trustee magazine over the last few weeks is the importance of boards like this trying to get younger members on the board who are going to be here for a while. Rob and Tyler would both fit that as well, and that was why I was asking the question, is I could see a fit for both of you. Rob maybe only fits here where Tyler fits both. So that was kind of what was going on in my head, but
Well, if you're looking for age, John, Virginia would beat me.
looking for a lot less age than any one of you or I have, but
I'd like to
It
ask a
doesn't-
question.
Go ahead, John.
Do you have anybody that represents the St. Regis and West End area?
I'm the only one right now.
That's what I mean.
Yeah.
and that's a point to be
Yeah.
considered for sure. And Virginia, I guess you're St. Regis, is that correct?
Yes,
Yeah.
and St. Regis feels very left out.
I know, we had someone until last spring who was from Hagen. So, which we're always looking for someone from the West End. It's hard to get people from the West End.
The less populated West End.
Yeah. Yeah. So do we have more questions for our candidates? What do you feel that you can bring to the board?
I think it brings.
Well, so we all have very different backgrounds. I'm more of a lab, molecular biologist kind of person. I know Lloyd is from business, has a business background, and
Medical equipment.
yeah, medical. John has a lot of background on different things. Fire chief is one, and he's also has a legal. He was an attorney prior to this life in Superior, and Tanya. Management and Forest Service, and Gary is a pharmacy background, and Jim, yours is education, right? Administration. So we are really try to keep it diverse. What additional could you bring to the board?
Well, I have a background in corrections and nursing, and being a business owner, owned a restaurant, and a good all-around worker. I've worked anything from working steak and shake car hop when I was in my 20s, to working in a cannery, to operating a laundromat. So I've got over 50 life experiences in work, supporting 4 kids, you know, and raising them by myself. We just went where the job was.
How long were you in RN?
About 2 years, and then it didn't pay enough for me to support 4 kids in Alaska. They paid me $5.96 an hour. And I was the night relief charge nurse. They couldn't give me more time. And feeding 4 kids and gas and all that 2 times, yeah, just, so I went into the restaurant business.
What about you, Tyler?
I guess my primary, thing I would mention just, I guess, is that, I have a lot of pre-hospital background, and I feel that it'd be nice to have that on here so that if things came up with that issue, that, you know, that I could help discuss that. Be kind of a connection there, as well as, I have a lot of history with working with, like, part of public health and mental disorders division, and all, you know, just a lot of aspects in that area with, as well as mental health services and Monroe, Missoula, Sanders County, all that. So I guess just, but mostly the pre-hospital part is what I'm, really feel like it would be nice to have that part on the board, and just be a way for us to kind of keep that connection, since it's a huge part of what, you know, we bring a lot of people here, we have a lot of impact on what happens, not necessarily directly, but just kind of things we do impact, so I have that as well.
You understand, though, that the hospital does not operate, you know, or the ambulance service. I mean, it's a different approach.
Yeah, we have.
Some health districts, hospital districts do, you know, operate the ambulance department as
Yeah, we're
a service,
private.
as a, as a part of the hospital, but, you know, it's not the way it is here.
Yeah,
Right.
Tyler's very active in the ambulance service, so I know
No, I
he knows that
understand.
connection.
Yeah, we're a private
Um,
entity, and and I also, I mean, technically by, my scope of practice is limited to 3 hospitals, so.
Right, right, no, I understand it, just so you don't think that the hospital manages or, you know, has.
There have been, I know, occasions where the hospital in the past has done a few things that kind of got the ambulance service's nose out of joint, and Tyler being here,
Maybe vice
might
versa,
help
too.
with that too. It could be.
From my experience in other
but
facilities.
Tyler sitting in the seat here might help
Sure.
see that
Oh, yeah.
that doesn't happen too. So
Oh,
there's
absolutely,
a
absolutely, I
positive on
understand.
that aspect too. So.
Do either of you have questions for us about the board service?
I don't know, I just feel, I mean, if I was going to the board, my first thing I'd want to do obviously is, I would look at the bylaws and everything to see where, I wouldn't want to just show up and like, so before I ask any questions, I'd probably want to review that sort of thing. So it's a little different
Absolutely,
for the board.
yeah. Yeah, absolutely. Do you have any questions, Virginia?
Beg your pardon?
Do you have any questions for us?
Yes, I did have a question, and that is, what does the board see as the most pressing issue right now?
The most pressing issue right now is
Yes.
getting our
Keeping the
financial
doors
house
Yeah.
in order.
Yeah. Becoming
Um,
solvent.
Right,
Right.
that's our first pressing issue right now, making sure that we will still exist a year from now. And after that, I would think it's probably the recruiting a permanent CEO. Anyone else have any other pressing? That's
No,
kind of how I saw it.
Yeah, I think
There's a
that's
lot.
a
Yeah.
fair statement. The only other thing I might add to it is, and they're all interrelated, is winning back the confidence of the
Yes.
community. And as I say, they're all interrelated. That relates to our becoming solvent, and our CEO selection has to consider that as well. So.
Yeah.
Well, I think one more we should be, as we're trimming and trying to become more efficient, is the patient care is still maintained by.
High quality patient care
Yeah,
is number
yep.
one.
Yep, yeah, and I mean, I include that in
Yeah.
community confidence, but you're right, it probably does deserve a separate mention.
Yeah.
I just wanted to make one more added statement in that when I was asked how long I had been an RN, worked as an RN, what I should have said is that my nursing experience as an LPN and RN covered over 12 years. And I worked in nursing homes and labor and delivery. And even though I was an RN for only 2 years, my first job was director of nurses in a nursing home.
Boy, they threw you right into the
And it was a
frying
tough
pan.
job because I had to fire unionized nurses. I had to give them 3 notices before you could fire them, and for dereliction of duty and, you know, sleeping on the job and pooling all the meds together and giving them to the patients, tying them down, and all kinds of horror stories. But that was my first job as an RN. And my second one was at the surgical intensive care at the VA hospital in San Francisco. And then the third one was in Alaska as a night charge nurse. Very small hospital, but I was the only RN and the nurse's aide, and you had to call the doctor by radio. It was horrible. But
That's frontier.
had they paid me just a little bit more, I would still be in nursing probably.
Hey, they go on a close meeting so we can make a decision. Okay. Well, I'm so, I was just so excited to have so many good applicants apply. since I've been on the board, I've not been in the position where we've had multiple candidates. This is just fabulous, and I'm just really grateful that you were willing to serve with us. What I want to do now, though, is I want to close the meeting so that we can discuss this, and when we'll hopefully this won't take very long, but I want to close the meeting so we can come to a decision. We'll open it back up, and we'll let you guys know.
Okay.
Okay, I'll move we close the meeting, go into executive session to discuss personnel.
Second.
So again, I'd like to thank both of you for interest, but we've come to a decision. So we need a motion.
I would move that we appoint Virginia for the unexpired term of the director.
Second.
Okay, all in favor?
Aye.
Are there any opposed? Okay. Welcome, Virginia.
Yes,
Yes, welcome.
welcome.
Yes?
She missed that whole
Did you
thing.
miss that?
I think she did.
I guess I wasn't expecting it.
Yeah.
You might want to say.
Yeah.
Thank you.
What's
You'll
that?
keep them on file.
Yeah,
Yeah.
and Tyler, you are very qualified, and I would encourage you, if you would like to throw your name in the hat for the permanent term, because of course this is only temporary, but if you would like to be considered for any future openings, we'd like to be able to call on you, if
There-
that would be okay.
Yeah, there is a distinct potential for there to be some future openings, so.
I know, I'll be around.
And you'll be here, so it was a tough decision. Okay, so one thing that we'll need you to do, though, is to go, probably after this meeting, we need to go to the clerk and recorder's office to do an oath of office. Even though it is temporary, because it's a district position, you still need to do that. So,
You can tell me where it is.
yeah, and, yeah, we can, yes, we can do that. Okay.
Well, you're both down in St. Rita's, right? So, of course, that doesn't help you get to the courthouse.
Yeah. We can show you where that is. Let's move on. Let's get moving. So, I don't know if you want to cover both the boiler license and the layoffs at
Well,
the same time?
in the interest of time, I'm gonna try to not say too much, but Leona's got her questions here, and we gotta get those answered in terms of the layoffs, but I'd like to incorporate, if it's all right, Madam Chairman, the boiler license, the layoffs, and my CEO report all
Okay.
one kind of thing, if that's all right.
Yep, go ahead.
Move that around. Well, I think I gave most of the folks in the public area too, copy of my update report that it's easier if I put this on paper and you can see what I'm talking about, so I don't get off topic too much, but we'll talk about the boiler license first. It's right there in the update report, but I should say right up front before any of this that it is not required that someone on staff at Mineral Community Hospital have a boiler license. Buck himself, we can use names, I really don't have any problem, I guess you brought it up earlier, but Buck did not have a boiler license for at least a year, I think maybe a year and a half after he got here, or after he was the maintenance supervisor. And I've been in this situation in several other interim assignments, and actually my old hospital up in Malta went through several periods of time where 6 months to a year, no one on the staff had a boiler license, and just like in Superior here, Hugh Hopwood backs up those guys, and he backed up Joe, Buck. So that is not a requirement, in spite of all the rumors that have been flying around Superior for the last month and a half. It is not required that we have a boiler license, and the world is not going to come to an end because we don't have somebody on staff without a boiler license. But having said that, I think it worked out pretty nicely. The two maintenance workers, Mike and Bajan, well, actually, I should back up. Angelo Viveris, very kindly through his spouse, pointed us in the direction of this Bill Fisher, who teaches a 40-hour course, in getting the boiler license. It pumps up those guys to, take the test for the boiler license. There are several places in Montana. We were already looking at Dillon, University of Montana Western has had a program for many years where they periodically teach a boiler license class. Madeline's nodding her head. I've used it for years. I did up in Malta and every place I've been. We've sent people over there for that course. But this guy, he comes out to Tricon, and we contacted him and does this. Tricon doesn't have anybody right now that needs the boiler license, but we got him to come out. He's been out here looking at the situation, and the week of, I think it's in the, well, maybe I didn't put it in there. Yeah, I did. The week of February 10th, he will be here that whole week, and both Mike and Bajan will go through the class and become certified boiler operators shortly thereafter. So, we're in real good shape. It's not an issue with that. The layoffs. Okay, the layoffs. I want to go through the whole scenario there so you understand. I did this with the commissioners, a couple weeks ago, but let's walk through it. And I thought Adam did a really good job with pretty much, with there's always little nits and grits with the article that appeared in the Independent, but and I made my notes on there to kind of clarify a few things and maybe give you a little bit more information about what happened with the layoffs. And that was my assignment, my number one assignment, when I came, to Superior 3 months ago, to Mineral Community Hospital, was to take a look, line by line, position by position, and believe me, you have a big problem with cash flow and revenue, at this facility. You certainly do. And we, that was my task. That was my assignment from the board, was to walk through that. Look at every expense, every supply expense, every contracted service expense, every position, line by line, and we did that. It took a lot of work, but Cliff and I and the leadership team and the supervisors did that in late November and almost all of December. And as I said to the board and to the commissioners, it was really, really unfortunate that that the board met in a way. It's very unfortunate that the board met on, what was it, December 21st, I think it was? 20th in December. And I presented that budget at that point, a 6-month budget from January 1, to June 30th to get us back in balance. And that, as the article says, that budget included 9 layoffs, well, actually 8. The 8's the correct number, but the bus driver had already voluntarily terminated, but he was one of the reductions, the half-time bus driver, because we shut down the bus. So there were 9 positions, and I presented that to the board. They approved it, and I've been around small towns for a very long time. Most of my 32-year career in healthcare has been in small communities. And once you tell the board, even though I swore them to secrecy and they agreed that they would not, talk about this in the community, I know better. And, the word would have been on the street the next day. Luckily it wasn't, but very shortly after that meeting. And I had a very strong obligation, I felt, to talk to those people that were being laid off. And I wanted them to make sure they heard this from me and not from somebody on the street. And so we did meet with some of those folks. We actually met with on Saturday, whatever date Saturday was. The board meeting's on Friday afternoon like this, and on Saturday I met with several people that were affected by this. And then the rest of them I met with on Monday morning. I stayed in Superior over the weekend. You know, I live in Helena, and I stayed over here that weekend to make sure that I was available all day Monday. Stacy and I and the union representative, Angie Mellon, met with the union folks that were laid off, as well as the management folks. 9 people, okay. And the numbers, Adam did confuse the numbers a little bit. There were 9 people, 4 full-time, 5 part-time. I think he said 9 part-time or something, but or 6 part-time. But the confusion there is there were 6 FTEs, 6 full positions that were eliminated. 9 people. A number of them were part-time positions. There were 3 management and 3 union FTEs, so it was split half and half. And Leona talked about, you know, the bumping process, the seniority process. And the way that sets up in the union contract, and you know, Stacy is very knowledgeable with the union contract and has reminded me of the clauses in that union contract, which you have to pay attention to. It's very important that you pay attention to it. But the layoffs on the union side, who the PTA that you were talking about is a union employee, okay? And yes, she has worked in dietary. Yes, she has worked in nursing. Pardon?
Housekeeping.
Right. She's worked in a number of other places. But the way the union contract sets up, we had decided to eliminate that position because we had a way to manage it without that position. And not anything to do with the person at all, but that position, we had a way to manage it, and it's working out fine, actually. Deb is providing some, you know, some. We just added duties to other people's work, you know, to not have to have that position, okay? And by union rule, it goes by job class, so there's only one PTA, and so we laid her off, and so she was without a job. But, you know, I don't know if you've kept up with the individual.
Yes, I know she hasn't.
Right. She is extremely happy. She has remained employed by us. I wrote a grant, well, I didn't write the grant actually, but I straightened it out when I got here. Just so I figured that we would have some people in this situation where with federal money or with grant money, we don't have to fund that out of our operating budget. So that particular individual applied for and did receive, you know, another position, and she's still with us. She's still working with us. She's just being funded out of a federal grant. So I don't see that, frankly, as a big issue. I think that situation worked out pretty nice.
Did she know that when she was laid off?
Oh no. We had not officially, filled that position. It was still open, right?
She knew of the possibility of the position.
Yeah. We told her during the layoff, you know, we encouraged her to apply for the position because it was open and stuff. So, but the way it worked out, I mean, in hindsight, I think it worked out pretty well. As I said in the article, truly, this was a very, very difficult thing. I mean, it's just, I haven't had to do this for a very long time, and personally, it's very difficult to lay people off. It's not an easy thing to do. Extremely difficult, and truly, it wasn't nearly as bad as I thought. I said to the commissioners that, and to a lot of people, a lot of people that. When I came back from a short break from the hospital in early December, I truly thought that it was going to be 15 to 20 positions, and only 6 positions and 9 people was a lot less than we had thought. Okay. And there was another grant position also, a halftime marketing and PR coordinator that was laid off, and that person was hired at the health center. So actually, 2 of the people out of the 9 actually are still with the system. One's with the health center and one's with the hospital on grant-funded positions. So in terms of impact of people, it's not quite as bad as the 9 people. We have been able to retain a couple of those people in the system.
How much are these classes for the operating engineers gonna cost?
A lot less than it would if we sent them to Dillon, way less.
I understand that, but you already sent the employee to Dillon, and he had an operating license.
Well, I don't know that that's relevant at all. Well, let me go back to that position. I'll talk about it real openly. We really, well, we have a way also, and I think I said this to the commissioners too. We had figured out a way in early December and built it into the budget, that 6-month budget, to handle the supervision of the maintenance workers differently. We didn't need a manager anymore. The position was not necessary. Sherry Spangler now, supervises both dietary. She is very gracious, for no more dollars, is very graciously agreed to, to supervise both those departments. And so if we can do that to reduce our expenses and reduce our costs, we have an obligation actually to the taxpayers to do that. And we need to get those costs down. They're killing us. I mean, the costs of the operation are out of whack. So we made that change. We made that decision to make that change, and it's a lot less expensive for us to do it that way than to worry about, the small amount of money that it's actually going to cost us to train that boiler operator. Those 2 boiler operators. I mean, it just is. It just is.
Did you offer him a reduction in salary to keep his job?
Why would we if we're going to eliminate the position? Why would we do that? We can't do that.
He had the seniority.
His position is not union.
I understand that.
Why would we do that if we're eliminating the position? How can we do that if we're eliminating the
Because we couldn't
position?
have bumped somebody out of their maintenance
No.
union position in order for him to
No.
come.
Did you really need to escort him out the door like he was gonna blow up the place?
I don't know where you heard that, but we didn't
From him.
escort him out the door. We did not escort him out the door. It was unfortunate that, as you said earlier, it's very unfortunate that that had to happen, a couple days before Christmas. I truly felt horrible about it, very
You
uncomfortable
wiped
about
out
it.
the man's whole family's income.
I understand that. Okay, I walked through this also with the commissioners. We made the decision that I'm talking about with the management of the the maintenance department, early on. The leadership team and I discussed that probably in early December, maybe even late November. And so we had a method to manage maintenance workers differently that saved us some money. That's why, and we built that into this budget. We also later on, probably 2 or 3 weeks later on, not too long before we presented the budget to the board, we realized that we could do without another housekeeper and a half, 1.5 FTEs in housekeeping. We could eliminate those positions. We did not need them anymore.
I understand.
Okay. At that point, I did not know, none of us knew who those FTEs belonged to, that 1.5 FTEs. All we knew was that we needed to get our staff down in housekeeping. Okay. About 2 days before the budget was, but then you have to go through the union bumping process, okay? And his spouse and another young lady were the 2 least seniority people in housekeeping. Again, we have no choice. By union rule, by job class, if you're laying off 1.5 housekeepers, and we felt terrible about it, realizing that we did affect that family's income with, 2 jobs, okay. But it was not a personal vendetta. I absolutely resent, hearing all these rumors in the community that Larry Putnam has it in for Mr. Patko and Mrs. Patko. I do not. I never have, and I never would do anything like that, to anyone. I felt horrible about it, but that is the way the union process went. So, I'm sorry about that, but that's the way
Was
it
John
went.
Updike present at that meeting?
Pardon?
Was John Updike present at that meeting?
No. No, I don't know what meeting you're talking about anyway. But.
Where you laid him and Bridget off?
Well, I don't know what difference does that make to anybody? I mean,
Because Mr. Updike was also let go.
yes, he was. He knew at that point that he was let go also.
He knew months before he was gone.
No, he did not. He didn't
He
hear that
said
from
so.
me. No, he did not.
Yes, he did, to me Saturday at my office.
You know what? Yeah, I think he understood that his
Yeah.
position probably was
Was
going to
redundant.
have
Yeah,
to go,
yes.
but no
He could
decision
see-
had been made
Yeah,
earlier.
he could see the writing
could-
on the wall
Right.
and the way
Who's
things
that?
were.
John Updike.
Oh, he's also leaving?
Oh,
He
he's
was
gone.
laid
He was laid
off.
Yeah, he was
Yeah.
laid
He's
off
part
too.
of these 9 positions.
Yeah, he's had
Yeah,
enough
he saw that as-
management experience that he knew it was coming.
Right. There's a difference between that and being formally notified that you're laid
Right.
off. I did not formally
I'm
notify.
sorry.
He's one of the folks that I talked to on Saturday, actually.
He has a head on
After,
business.
so. But, I'm just being honest and blunt with you here. I think that we
I
owe
am
that
too.
to you, that we owe that to you. But, I hope you understand why we did what we did here. It had nothing to do with any bad intentions. These people were all good people. It's a very, John said that, I think, at the December meeting. It is really a difficult thing when you have to lay off people or let people go that are good people, that are doing a good job. None of those people were not performing properly. We just couldn't afford to keep them on. It was strictly a business decision. That's the way we had to approach it.
I think the real bottom line here is that prior to Larry being here, management had shown a tendency to, when something wasn't going well, hire
Just hire someone
somebody
else.
else to come in and take care of it as opposed to taking care of it themselves. And we ended up pretty darn fat in the management aspects. We brought Larry in and we've done a revised budget and that has the potential to work. And given Larry, and I've been in this position myself in the past, a very thankless job of having to implement that budget. And it is not pleasant. I've had to lay people off and it is
Well, I have too.
not pleasant.
No.
It's one of the worst things you ever have to do in management. But it had to be done. If we didn't do it, at some point in the future, there weren't going to be jobs here for anybody. It had to be done to keep this place going. It's as simple as that. And boy, 6 months ago, the community was screaming bloody murder about
Top-heavy.
being
management.
top-heavy and how
Right.
many people they've hired and boom, boom, boom. Well,
I think-
we're fixing that now.
I think Leona has pointed that out to us in the past.
She
we were
has.
top-heavy. We aren't top-heavy anymore.
And, the bottom line is it had to be done. Nobody liked doing it. And once the board makes the decision on the budget, then it falls in Larry's lap, and I'm glad it wasn't in mine, and I feel sorry for Larry for having to deal with it, but that's where it falls. It falls in Larry's lap to pay attention to all the rules, the contracts, the bumping regulations, the union, the whole 9 yards, and do what he has to do to get us down to where we can meet that budget.
I understand that, John, I just protest the way it was done.
It's hard. It's
Well,
hard
and
for
we
everyone.
talked about the after Christmas thing, and the
1 week's
bo-
notice on your whole family's income?
the bottom line was that we felt it was more humane to let people know sooner than later.
Yeah, I think it would have been much worse if we.
Larry, you're
Yeah,
gonna put
go
the
ahead, Jim.
dollars to this?
The dollars, yeah, I've got the number.
278.
Oh, I'm sorry, it's in the
Yeah,
update report.
$278,728 is the savings.
That's over a year period of time.
Yeah.
Was that a year or 6 months?
It's annually.
Year.
Annually, yep.
Well, can I move on to the org chart then and stuff and the rest of the update report? I'll try to do that quickly. But, because of the layoffs, I have proposed a new organizational chart It's not perfect. Cliff was pointing out a couple of minor things that we need to change around, but I'm just throwing that on the table. It's not an action item this time, but next time we'll probably ask you to formalize that.
So is Roger Pafford officially the chief of staff? Has
I
he
shouldn't
been-
have left that on there. I have not
I was gonna
confirmed
say,
that.
has
No,
he
they have,
been
they have
confirmed?
not. I'm assuming
Okay.
that. It's a draft. It's a
Okay,
draft.
Well,
No.
that's something I'm concerned about.
Right, no, I
Making sure
understand.
we have an official chief of staff, it's
The
kind of
vice chief of
important.
staff automatically assumes, but I'm not sure we figured out who the vice chief is. You know, but we can talk about that later.
Okay.
Yeah, just real quickly, you know, I guess with me, I assumed all of John Updike's reports. I went from 4 reports to 12, I think, which is fine. I'm used to doing that. I've done that in other facilities. And this past month, we have spent a lot of time, the leadership team, making sure that all of these reports are comfortable with the folks that they're reporting to. We've set up meetings with the maintenance staff and with NARI and housekeeping and many others to make sure that we're communicating all of these changes and people are adjusting. So I think it's gone fairly smoothly actually internally, you know, with these changes. More people are picking up more workload certainly. But it's moving along. The contracts, you know, I'll just go through the rest quickly, the rest of the update report, but I have spent many hours the last month talking to physicians and physician assistants. We now have, you know, and that was another issue certainly. I've been working very, very closely with Cindy on it, but she's just about ready to sign contracts with a couple of providers over there, you know, Dr. Pafford and Laurel. I guess it's Laurel in the corner over there?
No.
Okay, she didn't come down. But anyway, we're getting very close. On my side, though, on the hospital side, we have to now contract for ER coverage during the day also. And it's pretty surprising. We talked to all of the people that do provide services on the inpatient ER side, and covering, you know, skilled, non-skilled, assisted living services during the day. We had the ER boys, as I call them. You know, we have 3 PAs who cover weekends and at night. Also KT, Karen Thornton, who comes over from Polson and covers. There are 6 contracts there, which I have gotten those contracts in place. They're not executed yet, but they all have them, and we hope to have that done by the 1st of the month. Regardless, Kirsten, I think, has the schedule pretty well plugged in, I think.
I was gonna say, how's that working right now, prior to those contracts being in place? We just
They're
did
all
it the way
working
we
on
were
their same
doing it?
schedules pretty much, and you know, the ER boys have stepped forward and given us more shifts than they used to, right, Kirsten?
Right.
And, you know, so that's going pretty well. It made us nervous, you know, filling those daytime shifts, but and Laurel and Dr. Pafford are also, you know, covering for us also on the hospital side, but you know, with the separation of the 2 organizations, you know, legally, there are lots of reasons why they can't come over here and during the day, you know, but
When they do come over though, they're paid by the hospital.
that's correct, by the hour.
Yes.
$500,000 a year for the whole package, but that's not that much. Well, it's a little more than it cost us before, but also the revenue from some of the rounding and stuff has come over from the hospital side. You know, Cliff can explain all of that, but you know, so there is some counterbalance there with some of the revenue and stuff. Grants, moving on.
Before you
Yep.
do that, I'd like to highlight that the clinic now will have 2 providers full-time, not if there's emergency in the hospital, one of them leaving. So
Right.
that has helped the clinic part of it be able to
Help get
handle
some
it.
customers back. They know they're not gonna have to sit there for hours. when
Well, somebody's
somebody gets
covering ER, yeah.
ER.
Right.
So
That will not happen anymore. And
That's a good thing.
it's not happening at all. Okay, well, quickly with the grants, there's well, I talked about the one grant, the community health worker grant that the PT person, was rehired actually, under. That person is trained and is rolling. The Elks Foundation grant, a couple months ago, actually, I wrote that grant for 3 BiPAP machines. That was the top priority, equipment priority for the medical staff. And hopefully we can get, if you ask for 3, you'll be lucky if you get 1. So we're hoping to hear about that grant early next month in February. And grant number 3 is a $7,500, $7,550 from the Small Hospital Improvement Grant process. And Julie Gamar-Williams, who is, our medical records supervisor, actually, HIMMSS, or whatever those initials are, supervisor, she is buying that software and setting up the training for the staff. It's very important training on coding for all of the clinical staff. So we're working on that. That grant will come also pretty quickly. In fact, the check should be in the mail. The Helmsley Foundation, there's a grant report due on that. And John told me before he left, when we had long conversations about all of his work, that there is some additional dollars there in 2014 and 2015 for some training and some marketing of mammography services. So we're still working on that too. And I think we talked about that whole next block pretty much with the with the finance committee before we came here. Maybe the one thing, let's see, one thing that I am concerned about that was part of the 6-month budget is the 403B plan administrators not confirmed if they will allow the hospital to temporarily suspend employer contributions, which was part of our 6-month budget. Stacy she's had trouble just getting an answer from them. So if that happens, though, we're counting on a considerable amount of money there, and we need to revisit that with the board, and we'll be keeping an eye on that, and we may have to come back to you with some way to solve that problem.
Are they just putting you off? Just won't give you an answer?
We know that it needs to be amended, so he's working on how to do that.
What's the problem?
I'm surprised that
What's
it
the
has
problem?
to be
I don't know.
amended.
He just keeps telling me that he's waiting for word back from them, so.
The legal people.
Yeah.
Okay.
The lawyers, the doggone lawyers.
What was the
Darn
issue
lawyers.
again, Larry? Larry, what was
Sir.
the issue again on that 340B? Because you said something about contributions, or what was it?
Yeah,
The 403B. 403B, it's the retirement. It's the retirement, yeah.
the retirement program
Okay.
plan for the employees. Again, tough decision, but we in order to make that budget balance, we're counting on dropping temporarily, hopefully, the employer contribution. I've seen that done at several hospitals around the state. Livingston did it for 2 years, to make their budgets balanced during the economic downturn. And so we use that tool here to get our budgets in balance. But we can't implement that. We can't stop that employer contribution to save the money until we make sure it's
Okay.
can be done, through the
Right.
through the 403B
What kind of
plan.
dollar are we talking?
It's in
It's
the about
23,000 every 6
23,000, I
months.
think, every 6 months. That was my ballpark estimate. But don't hold me to the number.
Jim, all of it's in this right here?
I just want to make sure everybody, okay.
Oh, okay.
Okay.
I'm sorry, yeah.
And do all the employees know that that's in the works? Okay.
I had employee forums after the layoffs with all, if they didn't show up, it's not my fault they didn't show up and get the word, but I did cover that in the employee forums.
Supervisors know as well.
Yeah,
Okay.
yeah, we talked about that. We certainly did. And, you know, certainly outpatient lab, x-ray, and physical therapy volumes are not increasing. You know, on the expanded surgery side, you know, you have to look at revenue opportunities as well as, you know, expense reductions, and we are really excited about, you know, the surgery program that's coming up, and I don't know, do we have it on the agenda somewhere else, or do we need to have Deb and Kirsten talk about that here?
About the surgery?
Yeah, can we do that, or you can hold it till later if you want.
Well, Kirsten's not here for the
Oh,
moment, so
did
why
she-
don't
Yeah.
we hold
she
it till
stepped out?
later,
Yeah.
so.
Okay, well, we'll, maybe later, we can talk about that in the agenda, but basically, Dr. Gardner is coming on board. Deb and Kirsten have been working very hard to administratively support that and clinically support that. Outstanding surgeons, both of them. Just encourage you to use the facility and use them. What's the latest date on Dr. Gardner is?
We had tentatively set the 28th of January, but he is gonna take or be off and out of the area the 31st through the 7th, and so rather than start a clinic and then not have him here for surgeries the next week, we've set that date for the week of February 11th. So his first clinical day will be the 12th, and the following week we will have surgeries start. I think at this point we have between 14, 16, maybe 18 patients even as of right now that are on that schedule and being contacted too.
And Dr. Gardner will do scopes, which is probably the biggest revenue generator, you know, for the facility, but also other surgeries. He's very used to small rural hospitals. He's been around several very small communities, understands that, you know, he understands rural communities and how we operate, and doesn't expect the world and, you know, $500,000 worth of new equipment to set up or anything. I think he will do a good job for us. He lives in Polson. We're trying to get him to maybe move a little closer, maybe over to St. Regis or something, but we'll work on that after he gets to rolling. So. And round 2 of the town hall meetings, there's a flyer around, but Cindy and I will be going around to Alberton. It didn't work out there. Well, they really didn't want us to come back. They're senior citizens.
Like kindergartners was their word.
Like kindergartners, oh, okay. But I think most of their health care goes in a different direction anyway, so.
Well, Steve built them up big time for us. What happens to that grant?
I think it was.
That grant is actually through the health center.
Right.
And
back?
it hasn't been given back per se, the last I knew. And understand just the way the dates fell this month, we have not had our health center meeting yet. That comes next week, but the last I knew on the subject, Cindy was trying to work with the granting agency to see if we could use it for something else.
Right.
We don't know. Last I know, I mean, maybe Cindy got the answer 5 minutes ago, but I haven't heard yet as to what that's going to be. And again, and I don't know, Lloyd, I guess, was there a finance committee meeting? Did that come up in that for health center? No, okay, because.
When is that meeting next week?
I got to turn this on again in a minute, and then I will tell you.
Okay.
I'm just learning how to run this.
I think it's the 30th.
I noticed the notices aren't in the paper anymore, so.
Do you know,
I
Jim?
think it's the 30th.
Thursday the 30th at 1.
Here,
Well, across
Oh,
the hall at
right.
the health center. And that is not a public meeting.
That's why the notices haven't been paid. Okay, back to the town hall meetings. We'll be in Superior, the schedule's in this handout.
Sure.
And that flyer and stuff, so. Week after next, we'll be in Superior, St. Regis, and at the Oasis in Dvorak. we'd love to have you come and talk about healthcare, any concerns you might have.
Okay, thank you, Larry, for your update.
Sure.
Very thorough.
Might I just add that making Lori responsible for the surgery was an excellent choice.
She's good.
She's very good.
She is very good. Approval of the check signing purchasing authority policy. Where did I put that?
Yes, I have something to say on that one.
Go ahead,
We
Lloyd.
made a minor change to it, because when you read it, it has the copy, it comes out that Larry's the only one allowed to sign it. So we made a change that in his absence, I'm just gonna wing it here, is that the CFO and or the board staff that has signature approval could sign.
Okay. Back up a little bit. I'm confused at what you're
Okay.
talking
Well,
about.
that's there,
So
gives
it
Larry
says,
complete authority to sign.
the CEO at the Mineral Community Hospital is hereby authorized to sign checks up to 10,000.
Right.
Okay, checks over 10,000 require a second signature.
But it assumes that you could interpret it if he's not here, no checks can be signed.
Yeah, I have the specific
Oh.
language,
So
Lloyd,
we
I
added
can.
the language,
Yeah.
okay.
Yeah.
The specific language is after the first sentence, we would add, in the
In his
absence of the CEO, the CFO or an authorized board member can sign.
We approved that as financial
In the
board to
finance
present to
committee.
the
Yeah.
board. But we'd like it
Say that
approved.
again, in the absence of the CEO.
In the absence of the CEO, the CFO or an authorized board member may sign.
Yeah, you don't want to be in a pickle when I'm not around or
Yeah.
something, and, you know, can't get a signature. You know.
Okay. And then, so then that would say, okay, there, and then checks over 10,000 require second signature. CEO is authorized to approve purchases up to 20,000. The CEO is authorized to approve supplies, contracted services, or equipment for any amount in case of emergency. And then examples, let's see, the board chair shall be notified if either of the situations described herein occur. The CEO shall obtain board approval for any new program or positions not contained in the current MCH budget.
Mhm.
Are we still getting our hospital supplies from Utah?
I have no idea.
Stacy, do you know where they're?
It's the same
Why would they
vendors
come
we've
from
used
Utah,
before.
pray tell?
I mean,
What difference does that make?
Since I've been here.
What are you talking about?
Steve?
No, they,
We've got the same vendor we've had for the last 15 years.
they come from all over the place. I mean, some might come from Utah, some might come from
Illinois.
China.
It's basically the same contract that we've had since Madeline was here.
And we shop around, if we can get a better price, we're
Right.
looking to do that, so.
Okay, so adding in that correction,
I'll move we approve the policy with that correction.
Second.
any further discussion? All in favor?
Aye.
Any opposed? Okay, policy is approved. Board training, this is really quick. I did get a training CD from MHA, the one that was our #1 priority. I have watched some of it, it is 48 minutes long. I thought that might be a little too much to put into a board meeting, so I'd like to schedule maybe a monthly training where we can get through, I think there's 8 of them, so that we can get through those trainings. I think they're really critical, especially as we're moving forward. The first one's about CEO, and there's a lot of really good stuff in there that I think would be very relevant to our search process and getting the right contracts in place, and as far as bonus structures and all of that is in there. So I think, the sooner the better, but I do have that in my hands.
Are they DVDs?
They're DVDs. So I thought we could, set them up in here and project them on.